Welcome to the Inova Center for Advanced Medical Simulation. My name is Dr. Emily Marco, and I'm an OBGYN provider, as well as the medical director of this center. This is a state-of-the-art center that was designed in order to recreate the healthcare environment for our nurses and physicians and learners in order to practice. We use robotic mannequins, such as our Noelle over here, in order to prepare for birthing situations. Today we are going to share with you a video of a virtual normal birth in order for our prenatal patients and families to know what to expect. We are going to show you some of our techniques for maternal positioning and birth alignment in order to promote safe vaginal births. These practices are evidence-based at the time of this filming. We encourage our patients to discuss their birth preferences with their OB providers.
Hello, welcome to Labor and Delivery. My name's Katie. I'm a labor and delivery nurse of 17 years, and we're going to take you on a tour of our labor room. So you know, this is a simulation room. All of our rooms are going to vary slightly based on location. The furniture may be different, the room setup may be slightly different, but all of our rooms are private and all of our rooms have a place for your birthing partner to sleep. I advise you to bring one bag with you, the stuff that you're going to really need here on this first day. Don't forget your cell phone charger though. We have space for you to charge your phone. When you come into labor and delivery, you're going to be asked to change into a hospital gown or in a gown that you bring yourself. And you're going to be hooked up to some things, so I'd like to explain each and every one of them so that you feel more comfortable. First is going to be our fetal monitor. As you see here, Noelle here is our fancy dancy robot. She has fetal monitors placed on her belly. That's going to be one of the first things that the labor nurse does. She's going to place a monitor to monitor your baby's heartbeat. That's an ultrasound. And a monitor here that's a contraction monitor. It tells us when your contractions start and stop. Don't be afraid if you're not contracting when you first get here. We'll get you there. Also, when you arrive, you're going to be given an IV line. An IV line can be saline locked or have fluids running depending on the needs and depending on your preferences and your doctor's preferences. We do run IV fluids in, and sometimes we give you medications based on your personal experience and what your personal needs are. Sometimes some of the medicines that we do run in are going to be oxytocin, sometimes antibiotics, and sometimes other medications based on your personal need. Here at Inova, we have many strategies for pain management. In early labor, you can be up out of bed, moving around, taking a shower. We have birth balls. We have walking monitors. Things that you can do to keep you upright and mobile, help that early labor get moving along. If your choice is to have an epidural for your labor, we would encourage you to let us know when you think that you can no longer go on with the pain. About 45 minutes is the key time for us to know when you want that epidural so that we can get the IV fluids that you need in and contact the anesthesiologist. When you have your epidural here, you will be remaining in bed, but we want you to be moving in the bed. So your nurse is going to assist you in turning and positioning depending on where you are in your labor to help encourage the labor to move along and help to give you that safe vaginal birth. If you took a childbirth class, your training in breathing, meditating, and positioning will help you with your labor and promote vaginal birth. So here at Inova, we have sent our nurses to workshops to help promote a safe vaginal birth. In those workshops, we have all learned many different techniques for helping you through all stages of labor and getting your positioning right so your baby will come out safely. I'm going to demonstrate some of these to my patient here so that we can talk about different stages of labor and different methods to help. First, we're going to start in early labor. Early labor is a time when you're excited you're here, things are going along great, you're not in a lot of pain yet. So we encourage you to be up, moving out of bed. We would love for you to use one of our walking monitors. If you're getting an induction, after that monitor comes off, get out of bed, move around, use our shower. Most important thing in this early stage of labor to get your baby in the optimal position is some belly forward moves. So I'm going to demonstrate those to our patient. So the bed, as you can see, is raised up about hip level, which gives me a good base. You can bend your knees at the end of the bed and sway back and forth. Moving that pelvis really helps that baby to find its place where it wants to go. You can go back and forth, you can do figure eights with your hips. You can come down onto your arms like this, always maintaining a little bit of a loosey-goosey in your knees here, and rock back and forth. This helps to bring the babies back into the anterior position and out of a posterior position, which can cause a longer, more painful labor. So our goal here in early labor is movement, movement, movement. So we want to use gravity and movement to help the baby get into an optimal position once active labor begins. Once active labor begins, you can continue on with natural childbirth, or you can choose an epidural. Our epidurals here are done in such a way that you can move around once you're in bed, and we have tools that can help us to continue your movement at all of our hospitals. We'll show you those next. Now that my patient is in active labor and has chosen to receive an epidural, I still want her to move around in the bed. I still want to help this baby to rotate and descend. One way that we can do that is by using some evidence-based birth tools, such as the peanut ball here. It has been shown around the nation to reduce primary C-section rate, which is an amazing thing. It also promotes safe vaginal deliveries by allowing the baby to get in an optimal position for vaginal birth. This is one of our most common peanut ball positions, just a nice side-lying recovery position. Most commonly this is done after the epidural, so you can take your nice long nap. I always want to make sure your knee and your ankle are supported and your body's in alignment. No twisting or turning, just nice and supported everywhere. This is the #1 peanut ball position you will encounter here at the hospital. The next peanut ball position encourages the baby to continue rotation. Bring your shoulders back towards me. Bring your legs back towards me. Nice and straight. There you go. The pregnant belly here, we're gonna lean it forward, just like we did in early labor, belly forward positioning. So with this position, I'm going to put the peanut ball under her belly, raise her knee, bring this leg back a little bit more towards me. Very good. Give you a pillow in the front. This is my patient's most favorite position because it encourages nice, restful sleep. It opens the pelvis here and allows the baby to turn the direction I'm trying to go. How does that feel? It's comfortable. Very good. The next position is continuing this circuit. If your patient or yourself has good enough mobility to come onto hands and knees, we're going to bring you into a hands and knees position. So come onto your knees. This is a great belly forward position. It allows the patient to do stretches, do cat, cow, cat, cow. Very good. This can be done with an epidural. The next thing I'm going to do is place the peanut ball under her breasts. Come down onto your elbows. This way she can be fully supported. She doesn't feel like her elbows or wrists are in any pain, and she's supported by the support person. She can also wag her tail like a dog and do cat and cow, also keeping that pelvis in motion. Babies love this position. To complete the circuit, you would do both of the previous two positions on the opposite side. What you do on one side, you must do on this other side. So to complete the circuit, we have the throne position. I want the patient to feel like a princess in this position, supported in all areas. This is another good napping position, and it allows the pelvic floor to relax. It allows the mother to be fully supported in the bed. She can leave her knees open. She can bring her knees apart for more relaxation. She can also use that peanut ball again as an asymmetric lunge. So one leg down, one leg up. Bring this leg all the way down. Anything we can do to stretch, to encourage the ligaments of the uterus to be fluid and mobile and really release this baby into the world. When delivery is near, your nurse is going to take apart your bed.
Now we're in the delivery position. We are going to use our birthing mannequin here to demonstrate some of the strategies that we have at Inova in order to promote a safe vaginal birth as well as our strategies to prevent vaginal lacerations or tears. We call this safe passages. Today we have the help of our birthing nurse as well as our birthing partner, support person that is here, and they're going to help show some of these strategies that we use. One of them is called warm compresses. So our nurse is going to apply warm compresses to the vagina in order to soften up the muscles and help them to stretch during delivery and not tear. Some of our other strategies include the way that we're going to be pushing at the very end. As you can see, our support people here are holding the legs, helping Noelle push down the baby. She's going to be bearing down for a count of 10 and pushing 3 times with every contraction. And at one point, we're going to want to slow things down so the baby comes out slowly and stretches the vagina naturally so it doesn't tear. Some of those strategies include the positioning. So I'm going to ask the birthing partners, support people, in order to bring the legs down just a little bit. That's great. And what that does is it engages all the muscles down here and helps to hold the vagina together. I'm going to ask Noelle to slow down and don't push. The strategies that physicians use in order to prevent vaginal tearing are twofold. One is to support the vagina and the other is to control the exit of the baby. All right, I'm going to control the vagina, and as the baby comes out, I'm going to ask Noelle not to push so hard, and I'm going to ease it out slowly. Here comes baby. A little more, just a little squeeze. And babies should come out slowly and naturally and mold the vagina as they come out, because the vagina is like a big elastic band. There we go, great. All right, baby's head is out. I'm going to ask the patient to stop pushing. Now, there's a cord around this baby's neck, and that's a pretty common finding that we have, and it's not something that we worry about too much. We might ask the patient to slow down pushing, or we might just take the cord and slide it over the baby's head. All right, here comes baby. I'm just sliding the cord. Controlled delivery. Up and over onto mommy's belly. Congratulations, it's a girl. Excellent. And who is cutting the cord today?
Oh, I would
you like to do
yes.
that? All right, I'm going to give you some scissors,
Thank
and I want you to cut in
you.
between these 2 clamps. That's right. Perfect.
Yay.
All right. And now we're going to finish drying off the baby. Now what we do at this point is just make sure that the baby's nice and warm and dry, and Katie's going to help clear some of the secretions from the baby. But the most important thing is that the baby starts crying usually within the first minute or so. Now we love to do skin to skin here. Katie, you want to describe why that's really good?
Skin to skin is excellent because it helps promote the baby's vital signs stabilizing, the heart rate, the breathing. Also helps with bonding with mom and baby from initial. Babies can smell their moms. It's really good for them. It gets them breastfeeding early on. Welcome to the baby alcove. All of our rooms are equipped with a panda warmer for after birth. If you have a nice vaginal delivery, your baby will be brought over after you have ample skin to skin time. The baby will get its first full assessment from head to toe. Heart, respirations, temperature are all measured here. We're going to measure the length of the baby and the weight of the baby, so don't forget to bring your camera. Those are Kodak moments you can't get back. We will do an assessment to check for anything that's abnormal, normal. We will also warm the baby over here, make sure the baby's ready to come back to skin.
Hi, my name is Tia, and I'm one of the postpartum nurses here at Inova Fairfax. Whenever you come here, you're going to recover on labor and delivery for about 2 hours, where they're going to monitor you very closely for any signs of bleeding or abnormal vital signs. So what that looks like in the first 4 hours that you are here on postpartum, you're going to remain in bed. You will likely still be attached to your IV, and you might have a catheter in place. After 4 hours, we're going to come in, assess you for feeling in your leg to make sure your epidural has worn off completely, and then we're going to get you up and walking. It's really important that we get you up and walking when you're ready. So we're going to walk to the bathroom with you. 2 of our staff members will be here with you, and then once you are comfortably back in bed, we are going to assess your baby right here in front of you. We like to do something called rooming in here, which means we promote having the baby in the room with the family unit for as much time as possible. This is really important to have the family really get to know your baby and the signs of hunger and what your baby is trying to tell you. We do have a well baby nursery available 24 hours a day, and it's designed to give your parents a little bit of relief in small increments, a couple hours here and there if you would need to take a nap. So your nurses are going to come in frequently throughout the day and the evening to check on you. It's going to be a common assessment if we're going to touch your belly right here just to check your uterus and make sure that everything is looking great. We're also going to be frequently checking the baby. So you'll see us with our stethoscopes checking vital signs on the baby and on you. At this time, we're going to offer the hepatitis B vaccine. The hepatitis B vaccine is recommended for most all babies, so you just let us know what your preferences are. And then after that, we're going to just keep getting you settled. You're going to be seen by a lactation consultant. All of our staff here is highly trained and very, very good at lactation support. So if that's your goal, is to breastfeed, we're gonna help you meet all of your milestones and get your baby to latch. And if you ever feel uncomfortable, you just let us know how we can help you, and that's what we're here for. Pediatricians are going to be stopping by. So a pediatrician is going to come see you every single day. They have to see the baby in the first 24 hours. So at some point they will come in and assess your baby and make a good plan. Your OB is going to be rounding. They're going to be coming by and making sure everything looks good and that you're feeling comfortable. Anesthesia, if you had an epidural, they will be coming by to make sure that everything has gone back to normal and you're feeling good about how your anesthesia worked on you. We do have an in-service menu. So what that means is the mom is able to order all kinds of food. We have an amazing menu that's all included, and then we have a few different food options for the support system. So dads, sisters, moms, whoever you choose to have here with you. We have a cafeteria, and during the day we have a couple little cafes that your nurses can tell you about. Now in the postpartum period, your hormones are going to be different than they normally are, and that's okay. Our staff here is well versed in how to handle any kind of situation, and any emotion that you might be feeling is okay to be feeling, and that's what we're here for. We have so many resources for you, for family members. We can help you get connected in the community with anything like that. Mood swings are very, very normal in the first couple weeks postpartum, and we're used to that, so don't worry about us. If your baby is a boy and you would like a circumcision, that can happen at any time during your hospital stay here, typically, as long as your OB offers that. It's done right here in our nursery. It takes about 10 to 15 minutes, and we can organize all of that for you if that's something that you're interested in. We love to help new parents with newborn care and answer questions so everyone feels well prepared to go home.
At Inova, our goal is for you to have a safe and joyous birth. Many of the strategies that we've demonstrated here for you today are evidence-based and have proven reducing C-section rates and promoting safe vaginal births. We encourage you to take prenatal classes and to access these resources. Thank you.